Aaron, thank you. It is 6:32 on the start of your Friday. During a baby's first 15 months, there are a number of vaccinations that are recommended by health professionals. The CDC says they include hepatitis B, polio, rotavirus, and then measles, mumps, and rubella, which is commonly known as the MMR vaccine. Well, a lot of them are given over a series of doses that continue into childhood and even adolescence. But with the COVID-19 pandemic, a lot of families fell behind on those routine shots. Our Jordan Johnson is sharing how you can get your kids back on track.
It's World Immunization Week, and the World Health Organization is reminding parents to get caught up on their child's vaccinations.
It is far better to prevent disease than to suffer the consequences of disease, which in many cases will be a severe outcome and potentially death. Vaccines are our best means to prevent these serious outcomes.
According to the WHO, more than 17,300 cases of measles were reported worldwide in January and February 2022, compared to nearly 9,700 during the first months of 2021. Thomas Russo is the chief professor of infectious disease at the Jacobs School of Medicine at the University at Buffalo. He says that since the COVID-19 pandemic, many children and adults have missed important immunizations.
We've learned that when we don't keep up with our vaccines, that we can have outbreaks of serious diseases that we thought were eradicated in this country. An important and most recent example have been outbreaks of measles in undervaccinated or non-vaccinated children that have resulted in a variety of serious cases and bad outcomes.
Chautauqua County, I spoke with Dr. Michael Falk, Chief Medical Officer for the county. He says the county is seeing fewer kids getting vaccinated after the pandemic.
Throughout the COVID pandemic, we saw a decreasing number of children getting routine follow-up and therefore not being on time for routine immunizations.
And according to the Chautauqua County Health Assessment of 2022, from 2017 to 2019, the county saw more cases of pertussis than New York State, excluding New York City. But Dr. Falk says it is typical to have an isolated case of polio and measles.
You see some of these things here and there, and then across New York State, some of these things are at times reported in isolated fashions.
For Dr. Falk, as a father of 5, he urges parents to look at the risks and benefits of getting immunized.
And it is clear to me, in my mind, that those benefits far outweigh the risks of vaccines. I want to do my very best as a parent to protect my kids, and this is one of the easiest ways I can do it.
Jordan Johnson, 7 News, Chautauqua County.